All right, guys, welcome back to the YouTube channel. I know it's been a while. It's been about a week and probably a few days. I'm sorry for that, but life has been pretty busy for me. Been doing a lot of travel assignments, as you know. Been going to different areas. Been trying to get into different hospitals, and as a result, I want to give you guys some tips on how you can better be prepared for a Med-Surg unit if you are a new grad, or if this is maybe your first time being on a Med-Surg unit. I got some tips for you that should help you out. So this is not going to be an extensive video, just a couple minutes on some things that I've used to help me in terms of when I'm on different units, or especially Med-Surg units, and this is my first time there. Make sure that you're thorough with your assessments, okay? So you check your skin. Do they have any skin tears? Do they have any incisions? Do they have any ulcers? Is there any redness on their heels and the bottom? How's the lungs sound? Are they clear? Is it any wheezing in their lungs? What about their heart? How's it pumping? How's the heart rate? What about the pulses in the radial? What about the pulses in their pedal? What about their neurological assessments? Are they there? Do they know where they are? Do they know where they've been? Do they know why they're here? What about aspiration? How they swallowing? Okay, things like that. You want to be very thorough in your assessments. The nurse that gives you a report the night before is going to tell you this and that, or that and this. All right, you don't want to live and die by that report and say that, well, the nurse didn't say that he or she had this, so they don't have this. No, do your own assessments. Be very thorough. Also, be well equipped with the medical supplies that you would need, such as your stethoscope, your pulse ox, your blood pressure cuff, your light for the pupils, and don't forget temperature machine. Things like that are going to be very helpful, because in our current situation, we're all having to check vital signs every day on patients in Med-Surg, nursing homes, prisons, because we want to make sure that there's no fever. We want to make sure that they're still breathing well. Make sure that they're receiving enough oxygen to their bodies. However, you can't be effective if you only are depending on the equipment at the hospital. What if there is no vital sign machine at the time that you need it? All right, and you didn't bring your own stuff, so now you're going to waste 30 minutes to an hour looking for a vital sign machine, when you could have been done with checking vital signs had you brought your own equipment. All right, so be thorough with your assessment. Dig deeper despite what you were given in report. Check labs on the computer. How are their levels? Okay, always check that. Check orders on the computer. For agency nurses, you may not be able to get in right off the bat, but once you finally get in, check as much as you can. How is their history? All right, what are they diagnosed with? What kind of surgeries did they have? Who is their emergency contact? Are they a full code? Are they DNR? Do they have any critical labs? Okay, these are the things that you want to make sure that you are checking on, questions that you're asking. And I'm going to leave you with this right here. When it comes to advocating for the patient, do not be scared to talk to the doctor. Do not be scared to ask the doctor questions, okay? Because that's what the doctor is here for. I know he's a doctor, okay? And he may have specifications on when he wants to call you. But at the end of the day, the most important thing is that you advocate for your patient. Don't let the doctor scare you into not calling him when you really need to talk to him, because that patient is going to have questions about their medications. They're going to want to know why they're on such and such. They're going to want to know how come the medication they were taking at the previous hospital didn't transfer to this hospital. You know what I'm saying? And these are things that you need to inquire of the doctor. These are questions that you need to bring to the doctor. If your patient has concerns, it is your responsibility to make sure that those concerns are answered. All right, guys, so that's pretty much it. I know it was short. I probably could have had so much more to tell you, but I'm kind of limited in what I got to say. I have only a couple hours before I go to work myself to practice the same things I just told you. But if you like this video, be sure to like, comment, share, and subscribe. Let's get to 1,000 subscribers. We're almost there. We're only just a few numbers away. And I know that we can do it. I know we can. And I know it's going to happen.